Hello, today we're going to talk about homework battles and vision dysfunctions, the hidden link. This is Dr. Valerie Fraser, behavioral optometrist. So, why look at vision? Well, 25% of children have a vision problem that can interfere with learning. And when you look at those that struggle in school, such as the reading disabled children, 73% of those children have some sort of binocular vision dysfunction and or visual processing problem. And those are the types of problems that we're going to talk about today. If you're surprised by those statistics, uh, then you may want to think about the difference between vision and eyesight. Most people think that 20/20 eyesight means that you have good vision. But just like hearing is not the same as listening, vision is much more than just eyesight. In fact, there is a myth that 20/20 vision is all that you need for learning. But distance eyesight is not the only visual skill that is needed. In fact, those that need glasses for distance, such as for nearsightedness, have no association with how well they are able to read and learn. In fact, those people that have distance glasses for nearsightedness often are the best performers when it comes to schoolwork. So, why does 20/20 eyesight not equal good visual skills? Well, first of all, you have to understand what 20/20 means. It means you can see a certain size letter at a certain distance, 20 feet. But when you're reading, your eyes have to do much more than just that. So when you are reading, your eyes have to move across the page fluently. They have to work together, and they have to keep the letters clear. So distance clarity does not really tell us how efficiently you're using your eyes at near. Reading requires coordinated and precise eye movements. These eye movements include eye teaming, or keeping the words single, eye focusing, keeping the words clear, and eye tracking, keeping your place when reading. Let's start with eye teaming. Eye teaming is being able to create a single picture. So you have input from two eyes that create one picture in the brain. Each eye needs to be pointing in the same place at the same time in order to achieve clear and single vision. Good eye teaming is also what gives us good depth perception and helps us with eye-hand coordination during gross and fine motor tasks. If the two eyes are not pointing in the same place at the same time, you can get double vision, like shown in the above picture. If sometimes, though, the double vision isn't quite all the way, and you get kind of a halo effect, like is shown in the in the lower picture. Sometimes the words just appear to move or unstable and are hard to look at. If if you want to understand how convergence insufficiency can affect your behavior at school, then you need to look at the research study that showed that children with ADHD are 3 times more likely to have a vision problem that can interfere with attention and learning. Specifically, this vision problem was called convergence insufficiency, or the problem that we showed before, which causes the eyes to have unstable print and or possibly double vision. In this study that they did, they asked the following questions. How often does your child have difficulty completing assignments at school? How often does your child have difficulty completing homework? How often does your child avoid or say she does not want to do tasks that require reading or close work? How often does your child fail to give attention to details or make careless mistakes in schoolwork or homework? How often does your child appear inattentive or easily distracted during reading or close work? How often do you worry about your child's school performance? So convergence deficiency is more common in kids that are diagnosed with attention deficit disorder. But what they found is that when they treated the convergence insufficiency symptoms, these academic behaviors greatly reduced. Another eye movement skill that's important for learning is the ability to focus the eyes and clear the words. The focusing works by the use of a lens and a muscle that controls the lens. When you look far away, those muscles have to do some work, need to relax in order to see clearly far away. When you look up close, those muscles have to do some work. In a young person, these muscles should be able to work easily, so you should be able to relax the muscles to see clearly far away, and then when you look up close, you should be able to do that efficiently as well. Around age 40, the lenses of the eye starts to become a little bit harder to move, and that's why a lot of adults need to go to reading glasses. But again, in a kid, this should be easy and automatic because this process develops really early in life, around 4 months of age. If that focusing system is not working the way that it should, then things can become blurry and hard to look at. Occasionally, it will also make it look like the distance is blurry, or they can have trouble transitioning between distance and near. Eye tracking is the ability to keep your place when you read. So that combines eye focusing and convergence, and then being able to follow along on a page. So in this video, the person on the left has poor eye movement skills. You can see that their eyes kind of bounce around and aren't very efficient, compared to the paragraph on the right where the eye movement skills go efficiently across and that person is not losing their place. Up until now, we've talked mostly about the ability for the eyes to move together and efficiently, so eye movement skills. But there's also another part to vision, and that includes processing the visual information. Some important visual information processing skills for learning include directional skills in order to distinguish between B's and D's, was and saw, visual discrimination skills to notice and pick up on the details, visual figure ground skills to pick out the relevant information in a crowded background, and visualization skills, which have to do with visual memory, remembering things in a sequence, and visual closure, which helps you quickly recognize common words. Visualization is also an important part of comprehension. So let's look again at the symptoms and behaviors often associated with poor visual skills. One of the things that we look at is to see is there eye strain, eye fatigue, headaches, blurry or distorted words, double vision, words moving on the page, words running together, and eye rubbing. Other symptoms can be omitting words when reading, losing their place when reading, rereads words, requires a finger or a marker to keep their place, especially after second grade, poor reading fluency, slower reading, and substituting words, and poor reading comprehension. Common behaviors associated with poor visual skills can include getting close to the page when reading, a head tilt or turn, covering one eye, moving the head when reading, needing to take a lot of breaks to get through the work, and then, of course, the behavioral issues that come with the homework battles. So avoiding reading or chapter books, having trouble sitting still when reading, having trouble attending to near work, saying I can't before trying, getting frustrated with school easily, acting out, and having attention problems or being mislabeled as ADD. So, what type of eye doctor looks at these vision and learning problems? Generally, optometrists like myself with the designation FCOVD will specialize in learning-related vision problems and are able to both diagnose and treat these problems effectively. In fact, the success rate with vision therapy with that most common vision condition that we see, convergence deficiency, is around 70 to 80%. It's important to recognize that it is easier to treat these problems in younger grades before the learning gets behind than it is when they get older and have developed other compensations. So while vision problems can be treated, these vision problems can be treated at any age, it's always better to identify them earlier and get treatment earlier so that if there is also a learning disability along with the vision problem, it is more, the eyes are working more efficiently, and so any intervention is going to be more effective. So thank you for watching this short webinar. If you need more information, please go to our website, newhorizonsvisiontherapy.com, or our Facebook page. You can also sign up for our newsletter. There's also a parent Facebook page that directly relates to parents interested in vision therapy. So that's called Vision Therapy Parents Unite. And there is an organization, www.covd.org, where you can also find more information. Please feel free to email us your questions or give us a call. Thank you.